Hi, I'm Kirsten, the Ectopic Pregnancy Support Podcast host. Thank you for listening, and I hope these stories and conversations bring you comfort and help you feel less alone. Enjoy this episode. Hi, Jasmine. Thank you for being here today.
Hi, thank you for having me.
Yeah, of course. Where should we start?
I don't know.
Bring me back to, I don't know, whether it's family planning or when you first had symptoms of your ectopic. I'm open to start wherever you feel comfortable.
Well, I will say that this happened last spring,
Okay.
March. I do have 2 children already.
Okay.
I guess it started like January of last year. We weren't really trying for a third baby. Like, it was up in the air, but it wasn't really like, we weren't really trying.
Okay.
But I kind of had an inkling that I might be pregnant towards the end of January or early February.
Okay.
I took a test and it was negative, and then my period showed up. So I'm like, oh, okay, so I'm not pregnant because my period's here.
Mm-hmm.
And then this brings me to like March 1st. I didn't test again because I had my period. Everything seemed normal. But come March 1st, I started having some pain in my lower abdomen, which was out of the ordinary. I thought maybe it was like a really bad ovarian cyst because I do have a history with those. And it wasn't my period because I had just had my period 2 weeks prior, and I'm pretty regular as far as that. So I knew something was up because I had the pain, and then I started having the bleeding. So I was like, okay, well, something's not right. So I had my mom actually take me to the emergency room because I was very concerned with the pain and the bleeding, while my husband stayed with our 2 kids at home. I wasn't expecting anything. I thought they were doing an ultrasound. It was a cyst or something.
Right. How old are your kids, by the way?
My oldest is going to be 7 in a couple weeks, and then my other one's going to be 5 in May.
Okay. Aw, fun ages right now.
They're good.
Mm-hmm.
So I went to the ER, and they brought me in. And they're like, "Is there any chance you're pregnant?" I said, "No, I just had a period 2 weeks ago." And they're like, "Okay, well, we're going to do a test anyways." This was like so out of the blue. I was not expecting it at all. And the ER doctor comes in. She's like, "So it came back positive." And I was mind blown because my first 2 were very much tried for, planned. I found out before I even missed my period for them both. So I was like, I think you have the wrong person.
This is someone else's test.
That too. I don't think that test is right because I'm not pregnant. I just had my period 2 weeks ago. And she's like, well, you are. She's like, we're gonna run the beta, like the number. And I said, okay. And they did that, and it came back that I was like 7 or 8 weeks pregnant.
Oh.
And I was like,
wow.
I was like, what? I'm like, I just took a test and it was negative. And I mean, don't really have, obviously, this was my first experience with an ectopic. And I don't really know anybody who has been through. I know my sister has, but I don't really know all the ins and outs or what the symptoms are or what to expect. But after she told me the number and that I was pregnant, I was like, well, something's wrong because I'm like, I've had 2 healthy pregnancies. I've never experienced this.
Mm-hmm.
And the first thing that popped in my head was, is this an ectopic? Because it doesn't feel right. And she's like, no. She's like, your pain's getting better. I mean, this is normal to have pain and bleeding. And I'm like, well, can we do an ultrasound just to check? And it was like a Saturday. And with it being a small hospital, they're like, we don't have anybody in to do that. You're fine. It's okay. And I'm like, okay. So I trusted her. I had no reason not to. So I went home. And then that Monday, I called my OBGYN to let him know. And I set up my first appointment. And it was like for the week after, 2 weeks after. I think.
Okay.
Um,
So you
so
would have been pretty far along at
yeah,
that point if it was 2 weeks from.
like 6 and 8 weeks that
Yeah.
I where about the numbers landed. Um, and I made the appointment, and I think it was a couple days later that I had the bleeding again, and it was a lot. It was a lot of blood. Like I have pretty. My periods are pretty normally on the heavier side, so I was like,
Mhm.
but this was heavier, and this
Mhm.
was. I was like, okay, something's not right. I know something's not right.
Right.
Oh, I want to add, but before this, before this had happened, I was in the store, and I had a feeling the whole time that something was wrong. Something's not right, and I never had that feeling with my first two.
Hmm.
And I went to the store and I was like, oh, I'm going to pick up a cute little onesie because I was excited. I was like, oh, okay, another baby.
Hmm.
I picked it up, and then before I checked out, I set it back down. I put it back. I said, no, I said, this doesn't feel right. It doesn't feel like I should be excited because in my heart, I feel like something's wrong. And then I think it was probably the next day is when the bleeding started. So I told my husband, and of course he's like, no, it's fine. It's probably normal, like trying to reassure me. And I'm like, no, like something's not right.
Hmm.
I called my OBGYN, which is an hour away
Oh,
because
wow.
we live in such a small town. And actually, just recently, the OBGYN office is just closed shortly after this all happened, the ones here. Anyways, I was
Mhm.
going to the one that was an hour away. So I drove up there with my husband, and I told him about the bleeding, and they immediately took me in for an ultrasound. And they're like, the doctor came in and she's like, I don't even see a sac in here or anything showing a pregnancy. Like, so you've either lost it or you're in the process of losing it. And she's like, but they did blood work, check my numbers. I'm sorry if I'm rambling. I'm trying to.
No, no, you're not at all. Sometimes it's hard to remember all the details in the
And
in the right timeline.
yeah, and then I say something. I'm like, oh wait, this happened first.
Yeah. No, that's okay.
She's like, I don't see anything. I want to check your numbers, so I'm gonna send you to the lab to have that drawn, and I'm also gonna have you go upstairs to the more formal like ultrasound room for the radiologist to look at it.
Hi, Kirsten here. Sorry to pause the episode, but I want to share a brief ad all about therapy. Rather than trying to reinvent yourself this season, what if you took the time to understand how you already are? Most resolutions don't fail because we lack discipline. They fail because real, meaningful change is built slowly through awareness and consistency. Therapy helped me in more ways than you can imagine after my ectopic pregnancy. A big breakthrough was when I was ready to try to conceive again. My therapist helped me understand and unravel how hope and fear can coexist. It's life-changing to get insights from an expert. If you're thinking about therapy this year, do it. BetterHelp is a trusted sponsor. Joining their service was the best decision I've ever made. BetterHelp will match you with a therapist based on your preferences, their own clinical experience, and over a decade of matching expertise. Make your mental health and growth a positive focus this year. Go to betterhelp.com/ectopic or choose ectopic pregnancy support during sign up and get 10% off your first month of therapy. Thanks for listening to the ad. Let's get back to the episode.
And they saw my numbers had increased from when they were at the ER a few days prior. They did the ultrasound. She's like, no, I don't see anything in your uterus. There's nothing in there. So she's like, so I think this is a miscarriage, is what the ultrasound tech or radiologist said.
Mm-hmm.
But then I went back down to the office, and she's like, I don't like the looks of this. She's like, because this might be an ectopic. She's like, I don't see anything. You're bleeding and you have pain and your numbers are going up. And she's like, I don't want to let you leave here until I figure out what's going on.
Mm-hmm.
So they sent me in for a second ultrasound with somebody else. I can't remember exactly what had happened at that moment. I think that was when they maybe saw something on. They said they saw something on my ovary.
Oh, okay.
I don't know if this is a cyst or a mass. I don't know if this is a fetus. She's like, but I I don't like the looks of it, and it looks like it's an ectopic, not just a miscarriage. I don't want to say just a miscarriage because miscarriages are awful too.
Right. They are.
So she brought in somebody else. She brought in an MD because she was a nurse practitioner or a midwife, I think. And they went over the options. They said we can do the methotrexate and try that. They said they would much rather want to do that rather than go right to surgery to see if the methotrexate would work.
Mm-hmm.
They brought me up to the OBGYN floor in a room to wait because they had to do all the blood work to make sure it was okay for me to get it. And I immediately said, is there any chance this is going to keep growing and my tube's going to rupture or wherever it is going to rupture? And she's like, well, your numbers are still on the lower side and I don't think it will. And again, I was like, okay, I have no reason not to believe you.
Yeah. Good for you for asking that, though. I mean, it sounds like you were aware of what an ectopic was based on your sister.
Yep.
So, I mean, that's great that you had. I mean, that's a very serious question to ask. I feel like a lot of us that have been in this circumstance where you're given methotrexate or surgery as an option, or maybe you don't even get an option, you're just told surgery or methotrexate. You have no idea what questions to ask. So
they didn't even really say, they're like, no, we're going to do the methotrexate and go from there. You aren't even entirely sure if this is what it is on your ovary.
Mm.
So they did that. They sent me home and they wanted me to recheck my levels. I think, what is it, after like 48 hours, something?
Yeah, 48.
And then again. And then they're like, well, it still might go up after the 48 ones because it takes time for the medicine to work.
Mm-hmm.
I went to the 48-hour one and they had went up, of course. I'm like, no, don't worry about it. It's fine. Then I went to the next one and it still had gone up. And I was like, I don't like, like, they're like, okay, so you need to come back so we can discuss what to do now since your numbers are still going up. And I was like, I just want you guys to do the surgery. I don't want to do another shot because I'm like, I think the hardest part of it was like the waiting game. It's like waiting to see if the medicine is working or if your tube's going to rupture. It's like, so anytime I felt a little bit something, I'm like, oh, that's my tube.
Yeah, the unknown of it all is excruciating mentally.
Yes, it is very much. I think honestly, that's probably what the worst of it was at that moment was waiting. And I did keep hounding them. I was like, are you sure? Are you sure?
Mm-hmm. Do you remember your numbers around that time? Was it like low thousands, like 1,000 or something?
I think the highest it reached was like 30 something thousand. It was,
my gosh.
It was up there. And I even went to a Reddit group and they're like, why are they giving you methotrexate for your numbers are that high? They're like,
I was just going to say that.
Yeah. And then I started doubting everything. I was like, are you guys sure that I shouldn't be having a surgery or something?
Yeah.
No, I obviously you don't use Reddit as your education source, but other people have been through it. Mm-hmm. They're like, your numbers are so high. I don't know why they are even doing this because they're too high. I do remember them being at like around 18,000 at one point, and then I remember it climbing up to like, I think it was like 32 when towards the end of it.
Wow.
So when I went for the follow-up, because my numbers did keep climbing, they're like, okay, first injection didn't work. Let's do another one. And I said, I don't know if I want to do another one. I think I want to do just the surgery. And this doctor was a different one from the first time. And of course they did the ultrasound again to see if it was bigger or smaller, if anything was there. And they're like, they'll see something on your ovary. And I said, okay. And she's like, I'm not really comfortable going in. And that's not even the pregnancy. And then I end up removing your ovary for no reason. I was 27 at the time, at 27 years old, to leave you with one ovary because she's like, because that's going to cause you issues down the line. She's like, so I'm not really comfortable doing that. But if you want to, I will. So it was like, I was thinking about it. I'm like,
a big decision.
vision. So I
Yeah.
was like, if it's just a cyst or something, I don't want to lose my ovary for no reason. So I said, okay, I'll do the second shot. And so they did that. And I think it was they did that. They checked the levels. I don't think it went up, but it also didn't change, or it didn't drop that much. I think it dropped by only like maybe 1,000, 2,000. So it didn't really that much. And then the day for my second blood draw, I went that morning to get it. And I was still waiting for the results. And then that afternoon, I was leaving. This was on March 18th. So this all started March 1st. And at this point, we're at March 18th. I was getting ready to go pick up my son from school. And I was on the floor changing my youngest. And all of a sudden, I had a pain in my stomach. And I felt dizzy and hot and sweaty. And I was like, oh my God. I was like, I do not feel good. Something's wrong. So I couldn't even get up. I had to crawl over to the recliner to get my phone.
Oh.
I got a hold of my sister-in-law, thankfully. I'm like, are you in town? Because I need somebody to take me to the ER because something's wrong. I feel like I'm going to pass out. She came and got me. She dropped me off. She went to pick up my son. My husband was working an hour away at the time. So I called him. I said, I feel this way. You need to come. I don't know what's going on. I'm at the ER. And I was they had me sitting in the waiting room for a little bit. And then I had like that overwhelming feeling of I'm going to pass out. Like you start hearing the thing in your ears and your vision starts blurring and you're sweating. And so I got up and I went to the receptionist. I said, you guys need to take me back now because I'm going to pass out on the floor if somebody doesn't come and get me. So she could tell I was being serious. So she went and got someone. They brought me back. The ER doctor there did an ultrasound. He's like, I see a little bit of fluid, but not much. He's like, I don't really know if that's coming from that or what it is. So I'm going to call the OBGYN upstairs to come down. And she comes down, she does the ultrasound, and it was a transvaginal one, and it was very painful. And she's like, that's kind of one of the telltale signs that there's blood like accumulating around there is the pain with the transvaginal ultrasound.
Yeah.
And she looked at it and she was like, yeah, no, you that tube is leaking. You're bleeding. So she's like, we're going to go in and we're going to do this and get it out, get your tube out or get the pregnancy out. So it was probably less than an hour later. They weren't in like too much of a rush because it wasn't like I was like significantly bleeding or that the tube had already ruptured. It was just leaking. Mm-hmm. In an hour and a half, they took me back. They said, it'll be an hour surgery. It won't be that big of a deal. We're just going to go in and take it out. They brought me back. And what was supposed to be an hour-long surgery turned into like 2.5 hours.
Oh my gosh.
Because she said she went in laparoscopically. She could see my tube. And she doesn't know what was on my ovaries. She's like, no, the pregnancy is in your tube. That fetus is in your tube. And she said it was so swollen that it was bigger than my uterus and it was leaking. And it was like adhered to my abdominal wall. It was adhered to my uterus. She's like, so it was a mess in there. She's like, you had blood from your abdomen all the way up to your liver. Like, and you've been bleeding for a few days. Like, this wasn't in like an overnight. This has been leaking for a few days. So laparoscopically, she's in there trying to clean it up and the tube ruptures while she's doing that.
Wow.
And she told me, she's like, I pulled right out. She's like, because we had to open you up. It was too much bleeding. So they went in through my old C-section scar and cut me open that way to control the bleeding, get the tube out. She's like, we were calling in help because there was so much blood going on. Like, it was a lot. She's like, we had nurses coming in from upstairs down to help, to assist. Mm-hmm. And she's like, we clamped off your tube. The bleeding stopped. And she's like, everybody stopped and took a big sigh of relief because we were genuinely scared that this was going to get worse. She's like, but your tube was gone. She's like, I had to take it out. And then they closed me up and sent me to the OBGYN floor where other people are having babies
I
to
don't understand why. I get that maybe, they don't have a specific floor for lost parents,
yeah,
but isn't there any other area
right,
outside of women having babies that
right,
we all can recover?
yeah,
Oh,
yeah.
I'm sorry.
So they took me in there and I was like, if I was having this baby, this is where I would be, but I'm not. So, um, and I was there honestly for they kept me for a few nights, which I was okay with because I would rather be safe than sorry. She's
Mhm.
like where you lost so much blood. She's like they had me taking iron and all that because my um iron levels were so low at that point because I had lost so much blood. So she's like, we want to keep you for a few nights, and I
Mhm.
saying, "Oh my gosh, you're so lucky. You're so lucky you came in when you did." And I'm like, that doesn't really make me feel better because it makes me feel like if I had waited much longer, things would have been a lot different outcome.
A lot different outcome. And it's crazy, yet I hear this from so many women that you knew from the get-go
I knew,
that
yeah.
something was off,
Hmm.
and you did advocate for yourself
Hmm.
to get the surgery because you knew somehow that the methotrexate wasn't gonna work.
Yeah. And I feel like I went into that second appointment for the follow up, and in my head, I was like, no, I'm not doing the shot. I want the surgery. I'm doing that. But it felt, I don't want to say it because I don't know what her intentions were, but it felt like she honestly just didn't want to be bothered to do the surgery. She's like, no, let's do the shot and get you out of here and go, is what it felt, honestly. And even when she did the ultrasound, she was very rough with it and she was very like quick. It definitely felt like just trying to get me out of the room is what it felt like. And like she was not hearing me. She's like, no, I'm not gonna do it because you're gonna lose an ovary and trying to find all these maybe valid excuses, but it's like you're not hearing me that I really don't think this second one's gonna work because the first one didn't
Yeah,
even make in my
yeah,
level.
that's
So
so sad
yeah,
that I mean, regardless if she had intentions or not, I know most don't, but
right.
we have every right to feel how we feel, especially in a vulnerable moment like that.
Yep. Yeah. I I felt bad because I'm like I didn't want to hold it against her, but any follow after that, I'm like, can I see somebody else?
Yeah. Yeah,
Because
and you have every right to
yeah,
mention that.
I'm like I'm not comfortable with her anymore because I feel like I wasn't being heard.
Yeah.
Actually, I wanted to see the first doctor that I had seen there because she was very like compassionating. She was like very kind and like gentle about the whole thing.
Mhm.
See her, but she was unavailable, and they wanted me to see an MD. Um, that first doctor, the nurse practitioner, she was very unhappy with the ER I went to when I first found out I was pregnant. She's like, that should have been like alarms going off, the pain and the bleeding, and you're pregnant. She's like,
Mhm.
matter if they don't have somebody there, they should have somebody on call to come in and do that. She's like, that's what I would have done. So she was not happy at all. She's like, we could have started to be taken care of begin and then they had you wait. And
Yeah. Well,
so
I'm glad someone recognized
yeah,
that and was truly compassionate towards your care
yeah,
and what you needed at the time.
yeah,
I do have a question. So, when you first went to the ER and found out you were pregnant, that was early March, and
yeah.
you said you had regular periods January and February. Did you spot it all
No,
outside of that time?
no, no.
No?
And so I can't remember the exact date of when I first tested. I know it was like towards the end of January or early February, and it was negative. And then I got what I thought was my period because
Mhm.
I had never experienced anything else. So I'm like, oh, okay, this is my period.
Yeah.
It lasted. It was probably a little bit shorter than usual, but
Okay.
it was there. So I was like, oh, okay, that's my period. And then
Yeah.
I got my another one, and then 2 weeks later, it was when I found out I was pregnant. I was like, this doesn't make sense because I just had a period 2 weeks ago.
Yeah.
So
Did they call that implantation then?
she said
Did they suspect that?
she thought maybe, but like implantation, from what I understand, is not as heavy as a normal period. So
Right.
it wasn't like spotting. It was a normal, what I thought was a normal period.
Right. Yeah,
Prior,
because I asked that, and this is something I shared on my Instagram last week, that when I miscarried in August last year, I was surprisingly pregnant, like you, when I went to a doctor's office, and they said, because I was bleeding heavily, and I wanted to figure out what's going on.
yeah,
And they said, could you possibly be pregnant? And I said, there's no way. I had my period 2 weeks ago.
yeah,
And sure enough, I was pregnant. And they said, well, that must have been your implantation. And I was like, but it's so strange because from what I know implantation to be and what was happening was completely different.
yeah,
So, I mean, it's I say it's nice to hear because it really isn't nice. And I don't like that all of us experience this, but it's nice to hear just knowing that it's so cliche that you're not alone
right,
in mistaking
yeah,
implantation for your period.
yeah,
Um, and that's, yeah, I don't know. It still confuses me, honestly, to this
yeah,
day.
yeah. It does for me too. I was like, the whole thing was confusing. I feel
Yeah.
there was
Yeah.
unanswered questions, and one of them was, I was like, I had two healthy, completely normal pregnancies, so I didn't understand why this third time it happened the way it did, because again, I had no issues the first two.
Right.
It's just random, it's spontaneous. I'm like, so I don't know. I don't know the reasoning behind it. I don't think anybody does.
No, I know. From what I know and from what my doctors have said, it's just a fluke that happens.
Yeah.
Yeah. Um, Now, since you had both treatments,
Mhm.
how did you feel about the two? I mean, did you obviously with your surgery and them having to go into your C-section scar, that's pretty uh severe. That's a
Yeah.
big surgery.
Yeah.
Um, how did you feel physically and mentally with both?
Like with the methotrexate and the surgery itself.
Yeah.
The methotrexate, physically, I didn't notice a lot of symptoms besides maybe being a little bit tired. They did explain that it's a chemo drug, um, but I didn't really have any physical symptoms. I think maybe a little bit of an upset stomach the first day, and I was a little bit more tired. Mentally is what was hard because, like I said, it was the waiting and hoping that it's working, and waiting to find out if my numbers went up, if they went down, if all of a sudden my tube's going to rupture because it grew more. That's what bothered me the most, was the not knowing
Yeah.
and find out.
Mm-hmm.
Like when I would get my levels checked, I was constantly checking the portal, like, are they back yet? Are they back yet?
I
And
know,
then
isn't that
I would be like, okay, so my numbers are this. What does this mean?
I know, isn't that wild when you do lab work, you're just in such a daze.
Yeah,
And I remember constantly just like picking up my phone every 5 minutes, refresh, refresh, refresh.
I did. Yeah.
And I swear I did that for days
Yeah.
between getting lab work done.
Yeah. I did
Oh,
the same. And then as soon as I got them, I'd be like, okay, it didn't change. So,
right. I know it's that.
okay, this isn't funny. I don't like this.
Hmm.
I was very impatient when it came to what my numbers were and if things were working or not.
Yeah. Yeah. And so with the surgery, you felt like it was a little mentally easier because you didn't have the waiting game.
Yep. I think that's why I had wanted the surgery towards the second part, the second half of it, because I'm like, I just want this done and over with. I don't want to wait anymore.
Mm-hmm.
And when I did have the surgery, it was traumatic, but in a way it was also like a weight lifted because okay, it's done. It's over with. There's no more waiting to find out. So mentally, like while like the loss and the trauma there from the surgery, because I was nervous going into the surgery before they put me down, because I know I've heard like horror stories and such with women who have been through that, and I was scared. I was like, am I going to wake up from this? Because I know there was bleeding, and then obviously while I'm under, I didn't know all what was going on, and while I was under, there was more going on that I knew about. So when I woke up and they told me, oh, you lost this much blood, we had to do this, I was like, oh my God. I'm like, that was scary. Like, I was talking to a friend yesterday, and I said, I think I read that the average was like 12 a year for like fatalities due to ectopics. And I'm like, it's so insane. It's sad to think that that could have been 13 if I hadn't gone in when I did. So
Yeah.
that's what bothers me.
Yeah.
And then we're like going off about, like, I knew they had good intentions, but they're like, oh, you're so lucky you did. You're so lucky that everything went the way they did. You're so lucky. And I'm like, I don't feel lucky right now.
I know. Again, I know they come from a good place and they're just trying to make you feel better, but those aren't quite the right words.
Yeah. Yeah. I was like, I don't know how to respond to that, because I do not feel that right now.
Right.
Yeah.
Yeah.
And one of the other things, during the midst of this, when I went in for the blood work to check my levels, the receptionist who was putting the order in and stuff, she saw it was the HCG, and she's like, oh, you're pregnant, congratulations, do you know if it's a boy or a girl? And I was like, well, actually, it's an ectopic. And she didn't know what an ectopic was, which is fine. Like, I don't expect everybody to know about it. And she's like, well, what's that? So I had to sit there and explain what was going on. She felt awful after. She's like, I am so sorry. I didn't know. I'm like, no, it's okay.
I'm sorry that happened.
Okay. It was just one of those things I didn't know how to respond. I was like, I don't know.
I know. I had that happen to me as well.
Yeah.
And maybe, I don't know how they mark it in the chart when you're going to get lab work done.
Mm-hmm.
Maybe it's not, like a huge caution mark, or who knows how they mark it. But I think maybe they should have a better signal saying like pregnancy loss or something.
I was just thinking that there should be some kind of, like, for miscarriages, ectopics, or any like issues with a pregnancy should be like marked with something, because it does happen, and it's like, it's okay, because I know they're doing it not with ill intentions, and they're just excited for you and happy for you, but it's like, I didn't know how to respond, and I felt awkward.
It is. It's
no, congratulations. I'm like, thanks. But
it is very awkward though, because you're still wrapping your mind around what's going on. And because there's so many unknowns, like, you just don't know what to say. And it's really awkward.
Yeah. And then it was kind of weird when I said, oh, it's an ectopic. And she's like, oh, what's that? I'm like, now I have to explain it.
Oh, man.
But.
Oh, man. Well, since you had 2 kids while you're going through this, how was that? Was it a lot?
It was hard because, like, I just wanted to, like, while I was waiting for the injections, obviously after I had the surgery, I was laid up and my husband was taking care of them more, and I just kind of chilled and didn't. But during the shots and stuff, I just wanted to lay in bed and not do anything, or lay on the couch and not do anything, but I couldn't do that because I've been a stay-at-home mom for the last 6 years, and my husband works all the time. So I was still the primary caretaker with him while I'm undergoing the stress of that. But I'm like, I also don't want to give off to them that mom is stressed about something and upset about something.
Right.
So it was hard balancing the two, but my two boys are really great. They're really sweet and sensitive, and they know when to chill out, kind of. I feel, especially with my oldest, he's more in tune with feelings and things that's going around. So they were really good about it, but it was still like, I just want to lay in bed.
Yeah.
Thing.
Aw.
Travel or anything. And I
Right.
would actually, I think it was a couple days before the surgery, I had taken my oldest to one of his classmates' birthday parties, and it was at an ice rink. And the mom was like, "Oh, are you gonna go ice skating?" And I said, "No, I'm not really good at it." But in my head, I'm like, "I'm not gonna go ice skating when I'm technically pregnant right now, and things are going haywire. I don't want to do anything to
Right.
guys that." And I didn't want to explain that either. I didn't really want to talk about it. But she kept coming at me like, "Are you gonna go ice skating? You should get on the ice skates and try." And I'm like, "No, thank you." Sorry, try to be polite. Like, stop asking me.
Yeah. Yeah. Those instances
Yeah,
are hard.
yeah,
Oh man. Well, I appreciate you sharing all
yeah,
of that. That's a lot. I mean, I was successfully treated with 1 dose of methotrexate, and I can't imagine that roller coaster of potentially getting another dose and then having surgery too. So, I hope you're proud of yourself and all
yeah,
that you've been through. I always say that this experience makes us so much stronger,
yeah,
and I am thankful for that.
yeah, most definitely.
Is there anything you want our listeners to hear or anything else you want to share about your story?
I think the biggest thing, like I know you said about advocating, the biggest thing is if you feel like something is wrong, then you need to advocate for that and tell them that, and not. I wish I would have been when it came to the second methotrexate. I wish I didn't give in to that, because then it wouldn't have been such a emergent and serious surgery, and it wouldn't have been as bad as it did. It would have been a shorter recovery. It would have been all the things. So I feel like I wish I would have went with my instinct the second time around and just did the surgery versus getting the shot. But at the same time, I feel like things happen for a reason. So maybe if I had gone the surgery route the second time, because they thought it was on my ovary. So I realized I was actually in my tube, and then taking my ovary, and then I'd be short an ovary, and then I'd still have to and then have to go through a second surgery only days later. So it could have been like 2 surgeries within a week. So
That would have been a lot.
yeah, I feel like it happened for a reason. So, but I do think people need to go with their instincts and advocate for themselves to their doctors, and not let them make them feel bad or make them think something's the wrong decision. Just
Yeah.
definitely advocate for yourself, or bring someone with you who, because it is hard to advocate for yourself when you are feeling that way, when you're going through that trauma. So I think also having somebody with you who can advocate more for you is a good idea too. As long
That's
as long as some advocating is getting done.
yeah, that's great advice.
Yeah.
Yeah, advocacy is so important.
Yeah. Because like I said, I knew from the beginning, I'm like, something's wrong. And
Yeah.
I don't know. When I went into the ER, when I found out, I felt like I had said something's wrong. This isn't right. And I let her say, "Oh, it's fine. It's normal. You're normal. It's fine. It happens. The pain happens, bleeding happens." And I'm like, "Well," I told my doctor, I'm like, "I want to go back and tell her, hey, by the way, it wasn't just nothing, because I don't want that to happen to other women or future women who go in with concerns, and they're just shut down and not taking their concerns seriously." Like, I'm like, you. When I went into the ER, when I had the pain, they had a portable ultrasound machine, and the ER doctor did it there. So I was like, well, why couldn't the doctor the first time around do that?
Yeah.
Because the doctor did it himself. But the first girl at the first time I went didn't do that. So I don't know.
It's so confusing how doctors do different things. I understand that all doctors have different specialties and things that they're really experts in.
Yep.
And I do feel like topics, I don't know, because I say they're rare, but I mean, the stats are high.
Yeah.
But I just feel like medical professionals don't quite know what to do with us, you know? And maybe it's because all of us have different stories because we're all different human beings, but yeah, I wish there was some like set process or way to care
Yeah.
for women experiencing ectopics. And I always hope that somehow it's marked in your chart so that a doctor is notified of the progression and things like that. But I don't know. I don't know how that works.
Yeah, I don't either. I mean, I feel like there definitely needs to be, obviously I don't know what they are taught in medical school, like not OBGYNs, but like ER doctors or family doctors, or if they're educated more on the factor in med school. But I feel like there definitely should be more of an awareness and education about that, because she went with the idea, oh well, your pain's getting better, so it's not an ectopic. If it was an ectopic, it'd be getting worse, but it was an ectopic. So I mean, and like you said, everybody's different, everybody's story is different. So
Right.
I don't know, I feel like if there's a concern there for it, I feel like you should probably dive into it to make sure,
I agree.
and not just go with, oh no, it's fine. And the statistics say the pain would be getting worse, not better. So, and that wasn't the case for me.
No,
And
it
I'm
wasn't.
sure others too.
Yeah. Amen to that.
Yeah.
I couldn't agree more.
But yeah, everybody's different. And
Yeah.
I know you said the first one worked for you, the first shot, and then there's others who the first shot worked. There's people who went right to surgery. There's people who the second shot worked. I mean,
Yeah, I know. I've met some that have had 3 shots and then had surgery. It's just everyone's different.
yeah.
Everyone's numbers are different. Yeah, it's crazy.
So I can see, while I think there should be more education about it, I can see how it's kind of a hard subject because we're all different, because everybody's body's different and have different stories. So what works for one person might not work for the other, such as the methotrexate. But I don't know.
Yeah, I completely agree. And maybe that's why it's hard to train
Yeah.
medical professionals because every case is different and unique.
Yeah. There's no concrete way to go about it, probably.
Yeah.
Well, I know there's not, but there's no no concrete way to go about it and to treat it, because you basically just have to try different things out to see what works each person.
Yeah. Yeah. Well, that's a great way to end it. Advocacy is important,
Yes.
and we all deserve compassionate care.
Yes, absolutely. And I'm glad while there was 2 doctors who I feel like there weren't, I'm glad that there was that one who was about it. And at least I know that other women under her care are getting that compassion from her. So I'm very grateful for her at least.
Yeah, I'm glad that you had her too.
Yeah.
It makes such a difference when you can compare them.
I should say the doctor who did the OBGYN who did my surgery, she was awesome too. And my follow-ups with her, she was like, I said I wanted to stay with her because she wasn't my regular OBGYN. I went to the hospital that was local versus the hospital that was an hour away where my OBGYN was.
Okay.
I can't drive an hour to get there, so I'm going to the local one. So the OBGYN there, she was really good too, and I was impressed with that and happy with that. She made sure to check in with me during my stay, and she explained everything with me. And then my follow-up appointments, she's like, well, I hope you know you're stuck with me now because I'm not letting you go as a patient. She's like, after that, she's like, I even told your husband, he's like, after that surgery, she's mine. So she's mine. And then unfortunately, she's like, well, when you're ready to try again, she's like, wait, she said about like 3 months. She's like, reach out to me, call, make an appointment like ASAP so we can get you in. And then unfortunately, the office or the OBGYN floor at the hospital shut down. They down. So I messaged her. I was like, well, what do I do now? I'm like, you guys aren't there to deliver babies or to do that kind of stuff because that floor and the staff's gone. She's like, well, the office is still here, the OBGYN office. We just can't do pregnancy. So you can see me for other stuff. And then a few months later, the office shut down. So she's not even there anymore to begin with. Granted, I haven't gotten pregnant since. I haven't tried to since because I don't want to go through that again. So
yeah, rightfully so.
Yeah. I'm like, I only have one tube left, so I don't know if I want to do it again.
Yeah. Everyone has their own opinions on, it's either people want to try right away or they want to wait a while until they actually feel like they want to pursue trying to conceive again. Everyone has their own thoughts around it.
Yeah. I had thought I was like, oh yeah, 3 months up, we're going to try again because even though that one wasn't necessarily planned for, I got excited and I'm like, I want that excitement again. And it made me feel like, oh, I do want another one.
Mm-hmm.
And that feeling just for me just started going away. I was like, I don't really know if I want another one right now. I don't know if I want to get pregnant again just because that was so traumatic.
Yeah.
And I do that again with the one tube I have left. So a year later, we haven't discussed it and it's probably not going to happen. We're enjoying our 2 boys and we're content.
Soak all that fun and love that they bring at that age.
Yeah.
It's so fun. Well, thank you so much, Jasmine. I really appreciate your time and your openness to share your story. Thank you for listening to the Ectopic Pregnancy Support Podcast. If you are looking for additional resources, head to ectopicpregnancysupport.com to learn more about my exclusive online support chat. Also, don't forget to follow me on Instagram and Facebook. See you next time.